The aortic valve is a valve in the heart between the left ventricle, the main pumping chamber, and the aorta, the blood vessel responsible for transporting blood to all parts of the body. Oxygenated blood leaving the heart travels through the aortic valve before flowing to the rest of the body. Aortic valve replacement and repair are open-heart surgical procedures to treat aortic stenosis, which is a narrowed heart valve that cannot open and close properly. When the aortic valve does not work properly, the heart will work much harder than normal. The left ventricle will thicken over time in an effort to compensate for this. The damaged aortic valve may be repaired or replaced depending on the severity of the aortic disease, the structure of the heart, age, and the diagnostic test results. Once the heart is accessed and connected to a heart-lung machine, the surgeon will either replace or repair the aortic valve. The damaged aortic valve may be repaired by tightening the ring around the valve, closing tears or holes in the valve, separating fused valve cusps, or adding support to the valve. The damaged aortic valve may also be replaced with a mechanical or a biological tissue valve. A mechanical valve replacement is shown here.